It's a shameful and lasting legacy, decades in the making. The Tuskegee Syphilis Experiment, one of the most prominent, but certainly not the only example of unethical studies on people of color.
Historically, they have been vulnerable and taken advantage of in research and in science.
In 1932, hundreds of black men with latent syphilis were lied to, lured into an ongoing government-led study with the promise of free health care. Instead, they were used and abused by medical professionals, never told about their diagnosis or treated, even after medicines had been discovered. So is it any wonder that today, in the midst of a global health crisis, there's a lack of trust that's proving deadly? Black Americans are dying at nearly 3 times the rate of white Americans, but only 38% of black adults are likely to want the vaccine, when now nearly half of all American adults are on board.
In this case, with the pandemic,
Harlem Gunness is the director of public health for St. John's University. He's studying the effects of the pandemic on communities of color.
throughout history, we're seeing similarities with the disparities of the infection. And we're also seeing disparity in its perceptions. So history is repeating itself over and over again.
That history has led to misconceptions and mistrust. It's known as the Tuskegee effect.
The vaccine has a chip, a microchip, where they can track you. The vaccine was made to get rid of our people. These are some of the perceptions that they're having.
This time around, government officials are determined to not let that happen again.
We just injected over close to 900,000 people. And if you go to the city and state and say, well, how many of them are black and brown? How many of them are New Yorkers? We have it, but it's on a hard form. That's unacceptable.
One way to combat those notions is with facts and information.
Okay.
Brooklyn Borough President Eric Adams joined city leaders in demanding a digital database that shows the disparities in vaccine access and distribution be created.
We should have been on the ground using incredible messengers, faith-based institutions, and saying, how should we be communicating to this constituency their reluctancy to take the vaccine.
Government officials across the world.
At St. Martin de Porres Parish in Bedford-Stuyvesant, Pastor Father Alonzo Cox feels responsible to make sure his parishioners are as informed as they need to be.
And I think if the vaccination is going to help slow the spread of, or even stop the spread of this virus, I think that would be the best interest for this parish community.
But the sins of the past still linger in the minds of many.
Sending you like lambs among wolves.
At St. Matthew's Parish in Crown Heights, Pastor Father Frank Black says his own skepticism is preventing him from telling his parishioners outright they need the vaccine.
I can't tell them to get it because I'm not sure if it's safe. All I can say is I'm going to take the chance and get it when I can.
The Tuskegee Syphilis Experiment left a lasting divide, but when it comes to closing the gap of health education and trust, there's no time like the present. Jessica Easthope, Currents News.